All right, hi, I'm John, and 4 weeks and 4 days ago, I ruptured my quadricep tendon while we were out on vacation in California, where I just slipped on a sloped rock and slid down, and before I know it, my leg crumpled and my kneecap was over here, and my muscle was pulling up, and I knew instantly that I had a serious injury there. So, fortunately, I was only 50 feet away from a road. I do a lot of backpacking and hiking, and this past year there's probably been 20 to 25 days where I've been anywhere from 5 to 15, 20 miles out away from anything. So I'm kind of grateful that it happened close to a road because we were able to get to the ER in Monterey very quickly and then fly home that night on a red-eye flight, and then got my doctor's appointment, and within 4 days of my accident, I had surgery. So I'm going to go through week by week my experience. It's been helpful for me to watch other guys that have gone through this. It's kind of a rare injury. Only 1.3 out of 100,000 people get this, and so it's kind of rare, but it does happen. Typically, it's with active people that are out doing things. Some people, it's a sports injury, but a lot of people, it's just some strange thing where they slipped on a step or a curb, or in my case, just slipped on a rock, and we end up here. So, week one after the surgery, you're gonna find it's pretty tough. Your week just sucks. I mean, there's no sugarcoating it. You're in pain. You're miserable. You're dealing with self-pity, trying to get through this, and you realize that you've got 6 months of rehab, and you can't speed it up. There's no way to speed this up. If you try to, you're just going to injure it, and you're going to be right back to where you were when the injury happened. So as far as the pain medication, I was on two drugs. I was on a steroid and also a painkiller. I opted out of the opioids, of course, and just popped the ibuprofen several times a day, and that took care of the severe pain. But I just pretty much just sat on the couch, laid on the couch, went to bed, went to the bathroom. That's about all I did. And fortunately, my wife was just so helpful, and feeding me, dressing me, because I couldn't get my socks on, shoes, pants, anything. I just could hardly move around and clean myself. So very grateful for the help I got. But as far as the mental part, yeah, it's tough. Your first day after surgery, I was coming off. They told me they gave me fentanyl and the whole concoction of drugs. So there was about 20 minutes there where I lost it mentally. Just uncontrollable emotions, and it's out of your control. Fortunately, that didn't last very long, and I was able to get myself back under control. But through that first week, there was ups and downs. You're dealing with a little self-pity. It's human nature, but my wife just said, I'm not going to deal with it. And so that helped me stay positive and keep me on the right track. Week two, a little bit better. Still, you're just dealing with long-term, pain. With my case, they told me I had to sit for 3 weeks before I started therapy. Some people start at 2 weeks. I don't think I could have done much at all at 2 weeks because my leg just still hurt and screamed anytime I moved it. It still had considerable swelling, still do, even after a month now. But as far as movement, I was able to get around a little bit better, still using, the crutches, but a little bit better. The third week, the pain's going away pretty much. After 3 weeks, I weaned off the one drug, and after the first week, I was off the other one as well. So I'm completely off all the drugs now, other than just taking a aspirin for blood clotting. So the third week got a lot better, and then the fourth week is when the start of the fourth week I started therapy, and I also went back teaching. I'm retired, but I teach part-time for Goodwill, teaching adults construction. But this really helped me mentally kind of get back in the game, and therapy was great. I got 30-degree flexion. That was after 3 full weeks. And then near the end of that week, a few days later, I got 45 degrees. And so that gives you a purpose, to work. You can do something now to actually help improve yourself. Whereas the first 3 weeks are just miserable because you can't do anything to start that healing process and improving your range of motion. So week 4 now, I just had my monthly 1 month out, I had therapy today and I got up to 60-degree flexion, which is pretty much on target. Some people are a little above that at this point. Some are a little behind that. So I'm right in that middle range there and feel pretty good about it. The goal is in 2 weeks to be up to 90-degree flexion and hopefully get rid of the brace. I still have some swelling, still some soreness in the morning. Just kind of hurts when I get out of bed. I just feel it, but then that pretty much goes away. It's just super tight where they sewed everything in there. But things have obviously improved greatly. Mentally, I'm just in a much better shape here. A lot of guys I see go through depression with this injury and just really have a tough time, especially people that are active like me and other people. But I didn't get that far, but yeah, it was tough here and there. But you just plow through it and look towards the future. So my goal during the first few weeks was just to stay active mentally. I read some books, watched some movies, tried to learn a few things, just to keep doing something, because otherwise you're just going to go nuts sitting there all day and just watching TV. So hopefully in a few weeks, I got the brace off. I'll have more mobility. The doctor gave me the go-ahead. We're flying down to Florida tonight for my wife's birthday here, so I can hopefully enjoy that. Get out of the house a little more and enjoy a little sunshine. We just got a bunch of snow here last night here in Indiana, but. So anyways, that's my goal. I'm going to show you my knee and then also show you some pictures of the actual surgery. So if you're squeamish, make sure you turn it off when I warn you that those pictures are coming up, because it's kind of gruesome, and some people can't kind of freak out when they see that. All right, so these are the comparison of my legs here, and you can see this leg I've been working out. I'm still trying to do some half squats, just do something here to keep it strong. This leg, you can see the muscles pretty well gone right here. There's just no lower quads here. Upper quads are gone too. But I've lost 1.5 inches on size. My incision is healed up pretty nice. Got a lot of dryness down around here. But I still have some swelling right here. It's still hard, which isn't atypical, but some people, they lose that quicker than I have. But it's just a little sore and tender yet. But overall, able to fire my muscles now. Today with getting 60-degree flexion, felt pretty good about that. So I reached some milestones here last week. I was able to drive for the first time, which was great for your mental health. And I was also able to work on my flexibility enough to be able to get my socks on. So I'm really working on trying to reach down and be able to get my socks on by myself. It's still a struggle, but at least I can do it now and not be dependent. So I'm going to show you a couple pictures of the actual surgery. So if you're squeamish, make sure you turn it off now. So I hope this helps anybody else that is going through this, and hope everybody has a great day.